There's nothing like an air of confidence, looking good and feeling good inside. But what if you had a skin condition on your face? Would that impact your self-confidence? We're about to discuss the common chronic inflammatory skin condition called rosacea with our guest, board-certified dermatologist, Dr. Dimitry Palceski. Good morning.
Good morning. Thank you for having me.
Thanks for being here. Let's talk about rosacea. What exactly is it, doctor?
Rosacea is a chronic inflammatory disorder that can give you redness to your face and can make you flush and give you pimples and give you bumps. And it's interesting because 1 in 20 Americans have it, which is about 16 million people.
That's a lot.
It is, but yet it's so underdiagnosed. And people that have rosacea, the problem with it is that their perception of themselves and the people that look at them often give them a negative impact.
And let's talk about that perception, because here the recent Face Values Global Perceptions Survey sponsored by Galderma Laboratories shows that many ways in which rosacea takes a deep emotional toll on sufferers. That's amazing. I mean, it really does impact them.
Tremendously, more than we ever thought. And actually what they did was they looked at 7,000 people across 8 different countries. And so in all these different countries, they found that there was a common thread. People with redness were judged differently. They found that they were looked at to be less attractive. They were found to have less of an ability to have a date or to go out with somebody or to get a promotion at a job. And because of that, it really affected the self-esteem of the person that had rosacea and also their social interactions with with everybody around them.
And we did a quick poll about that same thing we're talking about, and I'd like our viewers to take a look. Shall we? Let's do that.
What are your first impressions of these people on this picture?
Bad skin. I would say the lady needs a makeover.
They look clean cut except for the face.
Maybe sunburn?
They don't look too happy.
You need to change their skin.
If it's an allergic reaction, get some kind of cream to clear it up. If I was a woman, if I had to go out, then I'd put on makeup.
Would you hire this person, or do they look successful to you?
I wouldn't say I wouldn't hire them, but I'd say they aren't terribly concerned with appearance, and it would depend on the office, culture.
I mean, there's no doubt that it can really affect someone's self-esteem. So my question to you is, if someone has rosacea, doctor, what can they do? I mean, it seems like we need more awareness and compassion for that matter.
Oh, absolutely. Only 1 in 10 people, or 10% of people that have rosacea even know that they have it or are diagnosed by a dermatologist.
Really?
So you have to go seek treatment or find there has to be support groups and more education so people can treat their disease so that it doesn't get worse.
So why are they misdiagnosed? What's going on here? Why don't they know?
Well, rosacea is challenging because it can look like other diseases of the skin. It could look like acne, and actually half of the people that have rosacea think they have acne. So when they start treating their perceived acne, and they make the rosacea worse, they don't understand why. And then there's trigger factors. So there are certain things that make rosacea flare, and it's all the good things. It's the spicy foods that you want to eat, it's the red wines. If you're emotionally upset, it makes you flare or flush. If you wear certain makeups, it all makes it worse. There's also some research that suggests that there's a mite that lives on all of our skin called Demodex, and that mite has been shown to be found in greater quantities in people with rosacea, which can potentially trigger it even more.
So we know it's a chronic disease. Can you medicate it? Can you do something? Are there treatments?
Oh my gosh, absolutely. Once you find an accurate diagnosis, it can be treated.
Great. With what?
Well, there are a few different options out there, and unlike over-the-counter medicines, these are actually FDA approved to calm down all of the symptoms of the redness. Cilantro cream. Topical medicine you apply once daily, and within 2 weeks you'll start to see a reduction within those bumps. There's a oral medicine called Rosacea capsule, and Rosacea is fantastic because it works from the inside out. It's an anti-inflammatory that calms down the surface changes. And then for persistent redness, Mirvaso gel. You put it on and it can last up to 12 hours.
And doctor, what else should people know about these medications?
Like all medicines, side effects are possible.
Sure.
For cilantro cream, you can have some application site irritation, some stinging, some burning. With Mirvaso gel, they can be very similar as well. There can be some stinging, some redness, some tingling. You can get a little bit of irritation. And for the oral medicine, you can sometimes see a little bit of diarrhea. You can see some soreness to the throat or the nose. possibly some increase in liver enzymes, and every now and then maybe a little high blood pressure.
But again, I want to go back to the fact that if you suspect you have rosacea or you don't know, it's really important to get that accurate diagnosis from a board-certified dermatologist. Correct, doctor?
Yes, correct, because rosacea gets worse over time. And if you can treat it early, you can control the symptoms, you can watch the trigger factors and learn what they are, you can minimize all of the redness and the bumps and the pimples.
Fabulous. Thank you so much.
My
Thank you
pleasure.
for what you do. And to find out more about rosacea and treatment options, you can go to sulantra.com or our website, thebalancingact.com.